Vanessa, over to you.
Thanks, Renata. Hi, everyone. Thank you for joining me today and learning, getting the chance to hear more about digital health systems and how we can support. Thank you, Shane, too, because I had the wonderful opportunity to go to the Ipswich Hospital the other day and be part of a telehealth consult with Dr. Cruikshank. And that was a really good experience. As a palliative care specialist, he was able to dial into the Boona Hospital to some patients and keep that care up, and it was really good to see it working in action. You hear how these things work in theory, but really good to see the practical side. So thank you for sharing all of that. So I was going to talk today more about some apps and opportunities for healthcare providers and hopefully offer you some useful tips and tricks on how to use digital health systems within your practice. I get told a lot when I go to visit a lot of GP practices in particular, and some allied health and pharmacists as well, that it can seem like a lot of hurdles that you have to jump through to connect to digital health these days. However, what I try to tell people is that digital health is actually a little bit harder at first to get integrated, but once you actually take the time to do it within your practice, it's actually going to make for more integrated care and ensure the patient's health journey is as useful and as effective as it can be. And the only way to do this effectively in this day and age is via electronic and digital means. So I was going to take you through some tips and tools. Okay, initially I thought it's a good thing to start from the very basics. So I know there's a few of you, I know most of you are using telehealth at the moment, but there are a few that may be looking at setting up. And some of the things that you need to look at, or the common barriers that work against digital health, is internet access and speed. So here are some websites I've just listed here, which most people know, but it's good to remind everyone that you can check your availability for your area when the NBN is coming if you don't already have it, and you can also do a speed test as well. So they're handy tips, just to check if you're looking at setting that up within your practice. Some of the other, I thought I might list some of the websites that have already been covered today that are very useful. So the ACRIM resources and support tools I highly recommend, as Shane and Manjeet have also recommended. If you go on and actually subscribe, you will actually be sent a lot of the resources. You'll have access to education modules and lots of events and other checklists and that will be helpful too if you're using telehealth or looking at using it. There's a telehealth checklist available also via this website link. Manjeet also showed a very good checklist, so any of those sort of checklists that will help you with the prior, during and after the telehealth consult are all very good. Also the RACGP guidelines are great to get in, have a look at on how you get started. They've also got some great checklists, guidelines and standards as well, so they're very good. I've been asked just to cover off on the digital health incentive payments that do affect general practice at the moment if you're accredited and claiming the digital PIP. I did notice that there's some that aren't and some that are through the polls earlier. So the 5 requirements, just ignore my 6 points there are actually only 5. It's integrating healthcare identifiers, data records and clinical coding, using e-prescription within the practice, using your secure messaging, and that's a nationally compliant secure messaging provider, so either Medical Objects, Argus or HealthLink, and there's 1 or 2 others on the provider list that you can check that are compliant. Uploading shared health summaries, as Manjeet touched on, practices now need to upload 0.5% of their SWIPE, which is their patient database. So to give you a rough example, if you have a 5,000 patient database, then that would be approximately a minimum of 25 shared health summaries per quarter. And it's good to mention at this stage that those shared health summaries cannot be accrued over to the next quarter. They can only be used in that particular quarter, and it starts fresh for the following quarter. And they are shared health summaries that need to be uploaded and not event summaries. If you need any assistance around that, the digital health staff team and the engagement staff team at PHN can assist in that as well. If you need some assistance, just give us a call. I often get asked this question, is my health record actually useful? I have to use it now with my PIP requirement, but how useful is it actually for me and my patients? So all I can say is that at this stage, the My Health Record system is growing exponentially. So we have hospital discharge summaries being shared to the record currently, and that's been confirmed through the Toowoomba and Ipswich Hospital. They are doing this currently to GPs in the area. Shared health summaries, so shared health summaries include your medications, the patient's medical history, past and present, allergies and immunisations. that's a snapshot of what the usual provider will actually share to the MyHealth record if the patient has a record. Event summaries are slightly different. They're about an actual significant event, a healthcare event, so that might be an after-hours clinic or a doctor that they don't normally see. That's something that needs to be shared to the record. It's actually quite significant. Then they can upload an event summary. And then you've also got access to the MBS and PBS history within the patient's MyHealth record. So there is quite a lot of good data in there currently. There's also the medication and prescription dispense records, which are very useful for pharmacists at the moment. Advanced care planning documents can be uploaded by the patient as well as the custodian information, which is really great. Just letters are also available. And I thought I might just throw in some local stats that are a bit more relevant. So Manjeet mentioned that there's just over 4 million nationally registered for the MyHealth record system. But just in our Darling Downs and Westmoreton region, since these are stats from July, there are 78,101 patients registered with the MyHealth record, 128 general practices, 44 pharmacies, 85 public hospital and health services and aged care facilities. So as we can see, it's definitely growing within our region. Some of the biggest barriers to using digital health systems such as the MyHealth record is data, and I get this feedback constantly. Vanessa, how am I supposed to use these new digital systems when I have dirty data? And the time that it takes to clean that at the time of the consult is just not practical. So there are some tips that I do try to assist practices with, and there's 5 key things that I try to get them to look at now while they're moving forward to using the system. Looking at cleaning up the patient demographics, which is checked regularly anyway by most practices. Looking at the medication list and making sure that it's accurate and archiving all the old medication. Past history list, making sure that it's only significant and current history. Allergies, making sure that they're listed, and immunisations. And as all part of that, within the clinical software, we should be coding everything that we do. So that means selecting an option or a diagnosis from the drop-down menu and not free texting anything. I often get the feedback from GPs that, Vanessa, there's often not a relevant condition that I want to select from in that coding list. So I tend to free text. I say to them, just select the closest option. The coding is not perfect, but it does need to be coded. Then below there's a free text box once you've coded it to say what that might be, and that suits GPs a little bit more. One of the other requirements with using the digital health systems within health practices at the moment is integrating the healthcare identifiers. Now that's the identifiers that uniquely identify a patient, a provider or a practice that supplies the care. Without an IHI number or an individual healthcare identifier, you will not, if you don't have this in your software for the patients, then that means that if the patient has a MyHealth record and they come to see you and you want to access it, you won't be able to, as it's one of the keys to access the system. I thought I might share this tip because this is a tip within best practice that most practices will know, but I thought I'll share it regardless. If you're using best practice, you can do bulk matching of all your patient database. So this is done through your utilities menu and through bulk patient verification. Another little data cleansing tip that I can offer is inactivating your inactive patients. So within best practice, you can do that also through your utilities menu on the main page. You can search for visits from over 2 years ago, select not, and select add and OK. And that will give you the option to bulk inactivate. Keeps your data nice and clean. Medical Director, you can do the same thing with similar steps, which I can supply after the presentation. Another question I get is, now that we do have to meet the digital health requirements and sharing 0.5% of shared health summaries of our swiping, how do we track that we're on track for the quarter? So a couple of things that you can do. All of the practices within the Darling Downs Westmoreton region have been supplied a license for PenCat tool. If you don't currently have this installed, please let the PHN know because we can arrange to have that sorted. If you have the PenCat tool or what's called PenCS Cat Plus now, which is a suite of tools, you have the ability to do a date search report, which will enable you to see how many shared health summaries you currently have that have been uploaded. And you can print that to an Excel or Word doc. So that's a handy tip. Now that works with most software, so that's quite integrated. Other helpful tools that I can give you is that if you are a medical director user, then there is a free ePIP app that you can download to your desktop from the Medical Director website. It's called ePIP Tracker, and you can download that for free. That will enable you, it shows all the quarters quite clearly, what your swipey is, what your minimum upload target will be, and whether you're in the red or the green of meeting that target. So that's a nice, useful one. One of the biggest reasons for digital health and the rate that it's increasing in use is because of consumer demand. So we see this everywhere. We see everyone with their faces buried in smart devices, somewhere along the line, wearable devices. We see medical apps now doing diagnosis. We're doing a lot of remote care, and it's becoming very integrated into primary care practices as well. I like this stat here that 79% of physicians and close to 50% of consumers believe using mobile devices can help physicians better coordinate care. Interesting stat. And if you do have free time, have a look at the website healthplan.com.au. There's some really interesting innovation going on around patient records and that at-home care. Another little app that I thought I'd just raise today is something that's being trialled in New Zealand at the moment. It's called the ADA app, and it's actually a self-diagnosis self-management tool, which is a very debatable subject at the moment, but it links to their regular GP and assists them with that diagnosis. So that's some interesting information that's coming our way. Some of the other digital health systems being trialled at the moment, things like monitorisation at home. So Queensland Health are doing something around Net Health at the moment that links with the Medical Director software. That's being trialled currently. We've got the healthcare homes happening at the moment, supported by 10 PHNs, where they're trialling the My Health record with patients in their home. Queensland Health are also doing a lot of innovative steps towards improving their ICT within their hospital and connecting to primary care. Some really good things happening there. And also there's some improvements around telehealth and being able to just use an internet connection instead of software to actually do telehealth consults, which will make it a lot more accessible for most. So that's all I had to share today, just around some minor tips and tricks.